Welcome to the 16th installment in our MedResults Network educational webinar series. I'm Jamie Parrott, President of MedResults Network, and as I always mention at the beginning of our presentations, thank you so much to everyone for taking time out of your afternoon to attend. You may notice that in 2015, MedResults redirected our focus to include more education for our members, and although we are still primarily focused on cost savings, we simply want to ensure that you have both product and service education, and also so you have the basic business tools to successfully run your business and sell the products and services that you guys offer. A few updates before we get started. In the past 2 weeks, some of you may have received personal emails from me about a special invitation to an Althera dinner in your area. These dinners are being held all over the country right now, and they're going to be continue to be held as we move into the holiday season. But these dinners are by special invitation only and provide a first look at all therapy. If you'd like an invitation or you want to see if there's an all therapy dinner in your area, please reach out to me directly after the presentation. Also, for all the surgeons in our network, our members now have special access and a special discount to attend Implant Tech's Masters Educational Series, and this is in Las Vegas on November 14th. So if you'd like information on either of these events, both the Althera dinners and the Implant Tech implant training, please just get in contact with me and let me know. And finally, I'm excited to announce that some schedules moved around, and we are fortunate enough to have Dr. Cheryl Burgess from Washington, D.C. joining us next Thursday to provide a demonstration and training on Radius for hands. And I realize this is sort of short notice, but if you haven't registered, please visit our website after the presentation to do this. This training won't be recorded, so you must be in attendance on the day of the event to receive the education. And now to get started for today, this past weekend I was invited to speak at the Ultimate Aesthetic Training Workshop in Beverly Hills, where aesthetic physicians and nurses had the opportunity to learn about the benefits of incorporating non-invasive treatments into their practices. And I was really amazed at how many traditional surgeries could be avoided through the use of fillers and neuromodulators and devices. And I was also surprised, though, at the number of these treatments that were already taking place in aesthetic practices, even though many of them are off-label and they weren't advertised. So it was during my time at the event that I really started to understand how many practices had really become successful with these types of treatments, and how they did it was because of their unique relationships with their patients. And that really leads me into the topic of today. And today I'd like to welcome Stacy Christensen. She's from our longtime partners at Professional Office Services, or POS. She's the marketing director at POS, and she's going to share with you a little information about how some aesthetic practices have become extremely successful and overall more profitable by improving their communication with their patients. As a final reminder, after the end of the presentation, if you have questions for Stacy, please feel free to reach out to me, or as I always suggest, after the end of the webinar, there's a brief survey that's going to pop up in your screen. Simply just let us know whether you're interested in receiving more information. Okay? So without further ado, I'd like to introduce Stacy Christensen.
Thank you very much. Welcome, everybody. We're happy to have you here today while we talk about the relationships that we have with our patients who really are seen as consumers in today's world. So what I'm going to do is take about 25 minutes or so and just give you some really good actual tips, live customer examples of what I've seen from the industry nationwide, and sort of a takeaway exercise that you can implement back in your practices. I've sat through a lot of webinars in my past as well, and I've always found that when you can walk away with something sort of tangible and something that you can actually implement or to do, that they're much more beneficial. So I hope that the tidbits that you learned today will be helpful. So what are we going to talk about? We're going to talk about the patient-provider relationship and how things have changed because our world is so competitive and patients have so many choices that what we're seeing and what you're seeing too is that if they're not satisfied and if they don't feel like they have that lifetime relationship or that trust or loyalty with the provider in practice, they move on to the person down the street. And so really what it's all about is really just improving communication and being intentional about the relationships that we have with our patients. So let's talk about some examples. You live this every day, right? The landscape. There's competition out there. When I said earlier that patients are seen as consumers, it's true in some regards. They're shoppers. They're out looking, maybe for the bargain. You're always going to have that group of people, but people are looking for quality. They're looking for meaningful relationships. They're looking for value-added services. And they know that they have choices. For the most part, they know that, in the area they live, they've got a lot of different providers and medical spas and cosmetic services that they can seek out, and they don't have to go to just that one person. The beauty of the specialties and the practices that you're all in today is that it fits so nicely with the conversation that's going on at the national level, which is all about health and wellness. We know in the literature that we read that, we're moving toward being more proactive and not reactive. We want to have healthier lifestyles, stress-free lifestyles, and a lot of that has to do with what are we doing to communicate health and wellness to our patients well before they have an issue. How are we preventing some of those common diseases? What are we doing to help them maintain a healthy lifestyle? And again, patient satisfaction. If you're not implementing satisfaction surveys now in your practice or means through social media and so forth to measure patient feedback and their overall experience and satisfaction with you, I definitely encourage you to do that so that you know where you stand and where you need to improve. For the traditional dermatology offices out there, there's no secret that the volume is great, right? In some regards, the competition has to do more with how can you promote your value-added services and the fact that maybe you've got a lot of other services within your practice as well. Because we know that, skin disease, for example, 1 in 3 Americans have some sort of a skin disease. Melanoma rates continue to double. Skin cancer is more and more common. And so we know that the volume is out there and that people need to be treated. But again, what are you doing within your practice to add those other value-added services? So we say that the patient-provider relationship has never been more important. I just love this image. It's so funny. I look at this poster often and I think, this woman makes me smile. I mean, she really is about where we want to go in the future, right? We want a lifetime relationship with our patients. We know that the population is aging and they need this health and wellness and preventative services just like anybody else. I love it. Beauty redefined. It's never too late to benefit from good skincare. But there's something warm and inviting about her that just makes me smile. And when you look at this, that's the sort of brand image you want to give to your patients as well. You want them to have that warm, fuzzy feeling and that feeling that they're going to be well taken care of over their lifetime with you. So for purposes of the presentation today, I really define patient communication as everything. It's not just verbal. It's printed. It's digital. It's the nonverbal that you're having with your practice. So we need to look at every single communication that we have with our patient and ask ourselves if we're making a good first impression. So you have a lot of challenges today. I mean, it is a 24/7 world, right? If there's one thing that's changed in communications, this would be the biggest change, is that we no longer rely just on, email or the old snail mail. I mean, there is Facebook, Twitter, LinkedIn, Snapchat, instant messaging, you name it, you've got it. People are accessible and they can share their opinions and access information 24/7. And that's challenging. That's challenging to practices today because there's a lot of noise. So, I've been in communications for 20-plus years, and this is a stat that's always resonated with me. When you think about from the time you wake up in the morning until you go to bed at night, our brain processes 5,000 different pieces of information. That's in every bit of conversation you've had, any piece of information you've read. Somehow your brain has compiled 5,000 messages a day. And we know that if you really need to take action on something or you need to remember something, you usually have to have seen it or been told at least 4 different times before you're going to take that action or that behavior that someone is asking you to do. You know, part of the good thing is that for those of you that are on the call today, you've taken the first step. I mean, you want to improve the patient relationship. You know how important patient experience is. But you might not have the resources or the expertise, and you're just out there looking for good tips. So you've taken the first step today. So here at POS, we did extensive research a couple of years ago. And our research boiled down communication into 5 opportunities. We sort of categorized it. In interviewing some of our different practices, we saw that there were 5 distinct areas that practices could be intentional when it comes to engaging in communication. So we talk about the new patient in this presentation. We talk about when they're in your office and they're being treated or diagnosed or in for some services. We talk about when they leave your office and it's time to pay for services. We talk about the communication and the engagement that you have all year long with them outside of the office, and then what you're doing to grow your practice. So the take home here is that it's not just about attracting new patients and getting them to come into your practice. It's about how are you going to communicate throughout all of these different phases of their life cycle. And so we give you some tips. What you're going to see throughout the presentation is just, if you take away nothing else from the presentation today, it's that you need to commit to intentional, frequent, personalized, and integrated communications throughout your practice. So this is the take-home exercise. I'm going to walk you through a true communications analysis. So it's kind of a communication audit. You know, an analysis is a friendlier word. But it's really about how you can take a look at where you are today in all of your patient communications and how you can step-by-step develop a plan over the next few months to improve those communications, just one communication at a time. So the first thing you need to do is take inventory, right? You don't know how you can improve or where you're at without knowing what you're doing. So take a step back in the next week or two. Take a table or an empty counter space at your practice and try to, over a 2-3 week span, grab every piece of patient communication that a potential patient gets in your office. So that's all your marketing pieces. That's your registration forms. That's your financial communications, any of your pre- and post-op procedures, spa services, anything that a patient would actually walk away with. And that includes digital. If you've got messaging systems and you're sending scripts for phone call reminders, text, emails, all of that, just start taking out a notepad, making a list, and pull those communications. That's the first step. Take them out, look at them. And I think what you're going to find by doing that is, my guess is, that 75% or more of you are going to look at those materials and say, wow, we have inconsistency. Why isn't our logo and brand on this piece? Why do our pieces look so different? Really, in order to have that strong relationship with your patient, I can't emphasize the importance of branding enough. You need to make sure that all of your pieces look and feel and sound exactly like your practice. That means that there needs to be consistency in them. So let's take a look at new patients. We all welcome new patients. That's the livelihood of our practices, right? So, can't make this stuff up. Go ahead and look at this. So do your registration forms. This is probably one of the first impressions that a patient might have with your practice. Do they really look this mundane? No contact information, no logo, no practice name, no colors. What if you could do something different? Something real simple still, but look how much more friendly that is. It doesn't look overwhelming. The information's not crammed. I mean, these are just such simple techniques and little changes that you can make on your registration forms that will make a world of difference. What about a patient packet? Maybe you've got a lot of services, and you've got cosmetic services and medical spa services and treatments and so forth. I mean, you want to be able to communicate so much about your practice at one time. How can you do that? Maybe consider a patient packet. These are just some live examples from customers that we've worked with. This is a nice idea because it fits in a really good number 10 envelope. You can mail it out or you can hand it out in the office, but it gives you a brochure about your practice, so right away you're really talking about the value and the services that you add. A little bit of information about the provider and the services, the different locations if you have multiple locations. And then inside of that are all of the registration forms and privacy forms that you would like them to complete prior to the visit. So right away you're setting the stage for this great experience. You're telling them about all the value-added services that you can offer. And you're also trying to get them to complete some registration information, maybe in advance of that appointment, so that you can keep your practice running on time as well. Make sure that you take a look at your practice brochure. If you don't have a practice brochure, it's really time to think about that because your competitors do, and you really need to be making that good first impression. Remember how I said it's a digital world. If any of you have, which many of you I'm sure have implemented digital messaging, appointment reminders, reminders for past due balances, reminders for new services coming up, don't forget that that is a really powerful way to communicate. Patients of all ages today, even our older populations that we sort of have this preconceived notion of that they don't use technology, that's not true. We're evolving. I mean, look at that stat that 79% of practices 65 years and older have email. Absolutely very important to be collecting email and cell phone numbers so that you can start communicating to patients digitally as well, whether it's an email or a text reminder. This is another great way just to reach out to patients and share extra information. Let them know that they've got an appointment coming up. Market your practice a little bit to them so that you're not doing traditional appointment reminders on the appointment reminders, which are still very valuable, but you're communicating maybe in the new age and the new way that people want to be communicated to. So remember those inventories that you took that are laying out at your table. Go back and take a look at them and take a look at them from the perspective of a new patient. Maybe you can pull out some of those and try to categorize them and say to yourself, are we putting our best foot forward when it comes to welcoming new patients? What do our forms look like? Are we really talking about those value-added services and the extras they can get with us? Are we talking about the highly accredited providers we have? And maybe make a couple notes on that notepad. I mean, maybe there's just one or two things you'd like to tackle in the next 1 or 2 months that could improve a piece of communication. I mean, that's a win right there. You're committing to just knowing that you want to make your communications better, especially if you have found in your practice that you run behind a lot. Really, what could you do to streamline your registration processes? As simple as it sounds, a lot of it can be in just tweaking those registration forms and how you go about registering your patients. Okay, so you've got all your new patients. You've given them a warm, friendly welcome. They're in your office. They're there for their health and wellness treatments, their massage therapy, maybe cosmetic services. Maybe they're in there for a skincare concern, whatever it might be. We know that patients who walk away with some sort of documentation of the service they received that day and any follow-up that they need to do usually do a better job of adhering to those providers' advice. So it's very important to think about patient education. That is one thing on the landscape of healthcare today that's not going away, is that, practices, so take a look at dermatology, for example. You need to be documenting that you're giving your patients something about what you saw them for that day. You're going to be, measured based on whether or not you are engaging a certain percentage of your patients with patient education materials. So many of you, this isn't news to you. You might have an association that you get them from. Just encourage you, again, as you look at your suite of communications, ask yourself, is my logo on there, though, or is it somebody else's logo? is it information that our practice really believes in, or is it, something that our association preaches but we don't necessarily practice? Really kind of take a critical eye and look at the patient education that you have. Even those really basic, treatment instructions, they don't have to be robust marketing materials all the time. Again, anything that you're giving your patient is a reflection of your practice. So make sure that you've got your information and your contact information on there and your logo. Again, what are you doing after the patient has been treated to make sure if there were special instructions that they need to follow? How are you communicating that? For example, here's an example about, some plastic surgery. Make sure that you are letting your patient know that you care and that there are certain things that they need to be doing following that procedure. And again, that's the power of the digital world, right? We can push out emails and texts all day long. So again, similar to what you did with your new patient, take a look at that table of collateral that you've got. Maybe you're going to find that, wow, we don't really have any patient education, or what we've got is pretty bad. We're not doing a very good job in giving our patients education about the different medical treatments and preventative services that we offer, and maybe we need to take a look at that. Many of you have somebody that's in charge of patient education, and really engage that person with your providers and have a meeting and talk about what are the top 3 or 4 services or diagnoses in our practice that we really want to be making sure that we've got printed and digital communications on. Okay, so we're moving on through our patient communication life cycle. Okay, so a lot of practices overlook the power of financial communication. I kind of argue that the communications you give to a patient that communicates financial obligations and payments could be one of the most important pieces of communication coming from your office. Why? Because that's how you're getting your patient on balances. Many patients will pay for services and elective services up front or do a copay or a down payment deposit, but nonetheless, there's many statements and fees that will come following as well. And so you really need to analyze your communication tools. And it starts back at that new patient packet. Do you have a financial obligation or patient responsibility form or insurance disclaimers, coverage, etc., that you're putting in that patient packet so they fully know up front what their responsibility and obligations are for their services? Very important. If you send a patient statement, whether it's an electronic statement or a statement through the mail, is that statement clear and easy to understand? And we're going to go through some real best practices on that as well. And then, taking advantage of the electronic world. So there's a lot of different financial communications out there today that practices are utilizing. So we'll go through and we'll talk about a lot of them, but I love going back to that consistent branded look. No matter what you're doing, look how nice all of this looks because it's got your brand and your logo and your colors on it. There's no mistake that me, Stacy Christensen, a patient here, knows that this is coming from your practice. You've set that brand awareness with me, that over feel. And so I will expect that all of your communications are going to look like this moving forward. But sadly, that's not the case. There's many of us that I think we can relate to this. You get statements in the mail that look like this, okay? And this is definitely an example of a bad way to share financial obligations and responsibilities with patients. I look at it and I say, what's CPT? What is that description of service? It's speaking to the practice, not to the patient. Oh, I see that they want me to pay $107, but I have 120 days to do it. You're already setting the stage that they can have 4 months to pay their bill. Where's the brand? Why do you have so many columns that are confusing? Why are we giving patients the opportunity to pay over a certain number of months? And where are we highlighting that this is the amount due and when? So let's take a look at a best practice statement. Your brand, front and center. Many practices will use a QR code. That's very common as well. Take a look at the upper right, online bill pay. Again, we're evolving to our patients' needs. We shop online, they want to pay online. We're busy. We want to be able to log in 24/7 and take care of our financial responsibilities. Add a due date. Pay this amount. Make that front and clear. I'm looking at that. It's highlighted in green. There's no mistake that I'm going to know what I owe and when. Patient responsibility. Make sure that you're highlighting what their responsibility is. And don't give the option to pay over 4 months. Give them the option to pay on this date. One of the things I like, too, is that you can put a special message in here. So maybe you've got a new service or a new provider or new hours or something that you want to draw attention to. Make sure that you're letting your patients know that as well. Again, highlighting that online bill pay. I can't emphasize enough that times are changing and people want to do their business online. And then I just want to really draw attention again to that patient responsibility and due date. That's really what you want. That's how you're collecting patient balances. So a lot of practices aren't taking advantage of the option to print on the back of their statements too. It doesn't cost anymore, so why not do it? You're already sending out the piece of paper. Especially for the practices and services and the industry that you all work in, this is an awesome opportunity to promote those value-added services and special offers that you have going on. So I really encourage you to analyze your statement. Again, we just showed of statements in other industries as well. But there's a lot of value add that you can do with your statements. Add a circle to draw attention. That's something that can be done. Go ahead and add a handwritten note. That can all be automated. There's so many things that you can do by automating your statement processing. If you're like many practices, you have outstanding AR, right? Collecting patient balances is really challenging. And so you want to make sure that you're going ahead and you're leaving past due notices. If you have a digital messaging system, it's important to collect those cell phone numbers so that you can do that as well. When you mail out a statement, take advantage of the opportunity to promote your practice and your service, especially when it comes to monthly, awareness months. Maybe it's, Skin Cancer Awareness Month, sun prevention, you name it. You have a new service, you have a new provider, a new location, new hours. It's a great way and an economical way to not only share your statement with patients, but promote your practice at the same time. So we'll just kind of fly through this. I just really encourage you to review your financial communications. Take a look at what you're doing in your practice, especially that patient statement. If you look at it and say, you're right, it speaks more to us and the services we did, but does the patient really understand? Maybe we would collect our payments more easily if our statement looked better and we were very clear about what it was they owed and when. I think this is probably one of the most exciting things that I get to talk about is educational and preventative. This is the opportunity for practices to look all year long at how they're engaging patients. And in the industries that we're all in with the focus on health and wellness today, there are so many opportunities to market your practice and your services to patients. So if you don't have a marketing strategy or an annual calendar of communication touches with your patients in 2016, I encourage you to take a look at that. If you have a Facebook account or a LinkedIn or you blog or you tweet, really taking an opportunity to say, this is what I'm going to share every few weeks with my patients and schedule it out. But also with what are you doing when they're in the office as well, or what could you do to be mailing them throughout the year about some of your different services that you offer. The sky's the limit as far as what you can do for marketing. Certainly in the competition that we live in today, there's a deal to be had at every corner, right? So join in and really start promoting your special promotions and offers and engage with a partner in some direct mail campaigns so that they can really help you get the appropriate list and help you work that campaign. Can't emphasize enough that it's a great opportunity just to remind patients you have an opportunity for communication about their annual appointments. It's that time of year again, whether you do a digital reminder or appointment reminder card. I think this is an interesting stat. digital reminders. We get reminders for everything we do now. I don't know about you, but, for hair appointments, dental appointments, oil changes. If they've got your cell number and you sign up for it and give permission, that's how people are reminding us about our appointments today, because we're really, really busy. And it's easier to quick check a message on our phone sometimes than to wait for that reminder to get lost in the mail. A lot of practices, 'tis the season, are doing patient calendars. And I wanted to share this because I thought this was sort of a unique twist. Think about the opportunity to, if you give calendars to patients, as many practices do, top of mind, they put it on their refrigerator all year long. Think about what you could do at the bottom to customize that calendar. You could put your spa service hours, cosmetic services, but you could also use that as an opportunity to remind them of their next appointment. It sort of becomes their appointment reminder card as well. Patient portal adoption, many of you are struggling with that, and if you're using a portal, just highly encourage you. That's a great opportunity to remind patients throughout the year to engage with the portal as well. So as we wind down here, just take a look at those educational and preventative materials that you've got on your table. And, over the next several weeks, say, do we really communicate very well during the year with our patients? Are we being intentional? Do we have a newsletter? Do we have a Facebook account? Are we advertising? What are we doing to communicate to new patients, but our current ones as well, so that we're not just doing it when they're in the office. We want to have that lifetime engagement with them, so we need to think about frequent communication touches throughout the year. And lastly, we would be remiss if we didn't talk about patient acquisition. It's one thing to focus on the patients we have in the practice, absolutely. But we know that in order to succeed and continue to grow, we have to be really aggressive marketers in getting new patients and referrals as well. And so just some quick tips, referral pads and partnerships with other practices, that's very common. Referral programs among our current patients. Do you have a referral program? Do you have some signage in your office, a contest, a box, something? Are you giving your existing patients something about, giving them a rebate for a service at your practice if they bring in a new patient? And say thank you. Have a customer appreciation week. Have a special event. Do something where you're really encouraging them to come in and get a free something or engage with you. Say thank you. A thank you goes a long way. And again, make sure that you ask for that feedback, because a drop in patient satisfaction of just 5% can cost the practice up to $150,000 in lost revenue. I mean, that's huge, right? If I go in somewhere and I've had a bad experience, you know how this works. I leave that practice, I'm mad, I'm not going back, I don't want to pay, and I'm going to tell everybody I know how awful it was. So we need to be really proactive in making sure that we're offering the best patient experience ever. So it can be really, really simple. If you don't want to do traditional surveys and you're really embracing social media, think about back printing your business card and putting your Facebook account on there. Maybe you want to do a digital survey as well. There's specific surveys for specific specialties, and they can really get you some good information, not only on the overall patient experience during the time of registration, but rating your providers as well. So take a look at that practice marketing and ask yourself, you might be saying, but I'm not a marketer. Well, we all are marketers a little bit, right? We know what we like as consumers. We know what looks good, what sounds good. We know how to show gratitude. So first ask yourself, what are we doing to thank our patients? Do we send thank you cards? Do we do something special during the year? Do we do birthday greetings, seasonal greetings? Do we ask them for their feedback, whether it's through a personal phone call or a quick survey card or email? We ask them for that feedback. Do we need to maybe think about a referral program because we're not happy with our services, or Dr. Johnson opened up his practice down the street from us and we're fearful that he might take away some business? Maybe it's time to think about a direct mail campaign. A lot of us who've been in marketing a long time kind of think direct mail is dead, but it's not. There's a lot of power in postal mail still, and so you might want to consider that. And social media. Again, we know that patients are looking for their services and so forth online. They're doing Google searches. They want to know, they're looking for, Botox or whatever it might be. Is your practice going to be on the top 3 in their Google search? And then have fun with it. Have a contest. Have a contest among your front office staff. Who can bring in the most new patients in the month gets a free dinner. Have a contest among your existing patients for referrals. There's just so much fun that you can have with it as well. So we covered a lot, and I took a presentation that I usually spread over a longer period, and I kind of tried to condense it and go through some summary points, so hopefully I didn't go too fast. If nothing else, walk away today with a couple things. Commit to really having a strong brand for your practice. Make sure that what you do is done well, it looks professional, and that your logo and contact information is on every piece of patient communication you give. And then take an inventory of every communication touch point that you have. And it may seem overwhelming, but it's not. It doesn't all have to be done in the first week or the second week. Just continue to add materials that you share with patients, add them to that table, and take 10 minutes over your lunch period every once in a while and look at them and say, you know what, this month I'm going to improve this particular piece of communication. And if you look at them and you say, we haven't used this piece in 10 years, folks, hoarders we are not. It's time to throw it out. Why hold on to the old? Identify too, after we talked today about the different phases of the patient life cycle, if you will, and all the opportunities during their time with you in and out of the office that you might be able to have a touch point with them. And think about whether you have a gap somewhere along the line. And then really look at your digital strategy. If you don't have a strong electronic presence, maybe it's time that you take a look at that. So improve patient communication, just one communication at a time. In 2016, and how busy you are, if you even improved 3 communications, you're 3 communications ahead of where you were today. So with that said, just a little bit about POS before we close. We've been around for about 45 years, and we work with the healthcare industry on all of their communication needs, from print to statement processing, digital messaging, and surveys. So I really thank you for taking time out of your busy schedules to tune in today. I hope that you got some good tips, some good examples of what others around the country are doing. And I am more than happy to take any questions now or in the future. So I wish you a good rest of the day.
Thank you so much, Stacy. And for everybody who's still on the line, I just want to let you know, POS does a great webinar series as well, and they do some of these webinars. They list them online at their website, so I encourage you guys to visit POS in your spare time. Check out some of the other educational webinars that they do individually. And like Stacy said, if you have questions, there is a quick survey that pops up after this, and you can just tick a little box that says, yes, I'd like more information, and one of us will be in touch with you. So with that said, thank you so much for your time today. Remember, we have another webinar next week, training on Radius for hands. Feel free to go to the MedResults Network website to register, and I look forward to seeing you all again very soon. Thanks so much, and have a great rest of your afternoon.